Hello, welcome to my student support system. In today's class, we will discuss about part 5 of muscular system, which includes muscles of lower limb or leg. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel My Student Support System. In the leg, first muscle is Ilio Source. This muscle arises as two different muscles, Source major and iliacus. Source major arises from transverse process and bodies of lumbar vertebra and insert into lesser trochanter of femur along with iliacus. Iliacus muscle arises from the iliac fossa and sacrum. Iliacus muscle insert into the lesser trochanter of femur along with source major. So here you can see this is the origin for these muscles and this will be the insertion. These muscles help in flexion at hip joint and lateral rotation at hip joint. Source major is innervated by L2 and L3 spinal nerves and iliacus is innervated by femoral nerve. Next is Gluteus Maximus. This muscle arises from iliac crest, sacrum and coccyx and insert into lateral part of linea aspera of femur. This muscle help in extension and lateral rotation of thigh at hip joint. These muscles are innervated by inferior gluteal nerve, and gluteal muscle is the muscle site for muscular injections. Gluteus medius. This muscle arises from ilium and insert into greater trochanter of the femur. This muscle help in abduction and medial rotation of thigh at hip joint. These muscles are innervated by superior gluteal nerve. Gluteus minimus. This muscle arises from ilium and insert into the greater trochanter of femur. This muscle help in abduction and medial rotation of the thigh at hip joint. These muscles are innervated by superior gluteal nerve. Tensor fascia lata. This muscle arises from the iliac crest and insert into tibia through iliotibial tract. This muscle help in flexion and abduction of thigh at hip joint. These muscles are innervated by superior gluteal nerve. Piriformis. This muscle arises from anterior sacrum and insert into the superior border of greater trochanter of femur. This muscle help in lateral rotation and abduction of thigh at hip joint. These muscles are innervated by S1 sacral spinal nerves. Obturator Internals. This muscle arises from inner surface of obturator foramen. There is membrane over there and it arises from there. Pubis and ischium and insert into greater trochanter of femur. This muscle help in lateral rotation and abduction of thigh at hip joint. These muscles are innervated by sacral spinal nerves. Obturator externus. This muscle arises from outer surface of obturator membrane and insert into medial surface of greater trochanter of femur. This muscle help in lateral rotation and abduction of thigh at hip joint. and these muscles are innervated by sacral spinal nerves. Superior Jamunas. This muscle arises from ischial spine and insert into medial surface of greater trochanter of femur. This muscle help in lateral rotation and abduction of thigh at hip joint. These muscles are innervated by sacral spinal nerves. Inferior gemellus. This muscle arises from ischial tuberosity and insert into medial surface of greater trochanter of femur. This muscle help in lateral rotation and abduction of thigh at hip joint, and these muscles are innervated by sacral spinal nerves. Quadratus Femoris. This muscle arises from ischial tuberosity and insert into intertrochanteric crest of femur. This muscle help in lateral rotation and stabilization of hip joint. These muscles are innervated by sacral spinal nerves. Adductor Longus. This muscle arises from pubic crest and pubic symphysis and insert into linea aspera of femur. This muscle help in flexion and adduction of thigh at hip joint. These muscles are innervated by obturator nerve. Adductor Brevis. This muscle arises from inferior ramus of pubis and insert into linea aspera of femur. This muscle help in flexion and adduction of thigh at hip joint, and these muscles are also innervated by obturator nerves. Adductor Magnus. This muscle arises from inferior ramus of pubis and ischium and insert into linea aspera of femur. This muscle help in flexion and adduction of thigh at hip joint. These muscles are innervated by obturator and sciatic nerve. Pectineus. This muscle arises from superior ramus of pubis and ischium and insert into pectineal line of femur. This muscle help in flexion, adduction of thigh at hip joint, and these muscles are innervated by femoral nerve. Gracilis. This muscle arises from the body of inferior ramus of pubis and insert into medial surface of body of tibia. This muscle help in medial rotation and adduction of thigh at hip joint and flexion at knee joint. These muscles are innervated by obturator nerve. Quadriceps femoris. This muscle arises by four heads, or sometimes these heads are known as four separate muscles, and these are rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Rectus femoris arises from the anterior inferior iliac spine. Vastus lateralis arises from greater trochanter and linea aspera of femur. Vastus medialis arises from linea aspera of femur, and vastus intermedius arises from anterior lateral surface of body of femur. These all four muscles insert into patella as the quadriceps tendon and then to tibial tuberosity as patellar ligament. All four heads of the muscles of this quadriceps femoris, they help in extension at knee joint. Rectus femoris acting alone help in flexion of thigh at hip joint. These muscles are innervated by femoral nerve. Hamstrings. This is a group of three separate muscles and these muscles are biceps femoris, semitendinosus and semimembranosus. Long head of biceps femoris arises from the ischial tuberosity and short head arises from linea aspera femur and insert into head of fibula and lateral condyle of tibia. Semitendinosus arises from ischial tuberosity and insert into shaft of tibia, and semimembranosus arises from ischial tuberosity and insert into medial condyle of tibia. All these muscles help in flexion at knee joint and extension at hip joint. These muscles are innervated by tibial nerve. Tibialis anterior. This muscle arises from the lateral condyle of body of tibia and insert into first metatarsal and first cuneiform. This muscle help in dorsiflexion of the foot at ankle joint. These muscles are innervated by peroneal nerves. Extensor Hellucis longus. This muscle arises from anterior surface of fibula and insert into distal phalanx of great toe. This muscle help in dorsiflexion of the foot at ankle joint and extension of great toe. These muscles are innervated by peroneal nerves. Extensor digitorum longus. This muscle arises from lateral condyle of tibia and anterior surface of fibula and insert into middle and distal phalanx of toes. This muscle help in dorsiflexion of the foot at ankle joint and extension of toes. These muscles are innervated by peroneal nerve. Peroneus longus. This muscle arises from lateral condyle of tibia and body of fibula and insert into first metatarsal and first cuneiform. This muscle help in plantar flexion of the foot at ankle joint, and these muscles are innervated by peroneal nerve. Peroneus brevis. This muscle arises from body of fibula and insert into fifth metatarsal and first cuneiform. This muscle help in dorsiflexion of the foot at ankle joint. These muscles are innervated by peroneal nerve. Gastrocnemius. This muscle arises from the medial and lateral condyle of femur and insert into calcaneus as Achilles tendon. This is also known as calf muscles. This muscle help in plantar flexion of the foot at ankle joint and also flexion of knee joint, and it is innervated by tibial nerve. Soleus. This muscle arises from head of fibula and medial border of tibia and insert into calcaneus as Achilles tendon. This muscle help in plantar flexion of the foot at ankle joint, and these muscles are also innervated by tibial nerve. Plantaris. This muscle arises from lateral condyle of femur and insert into calcaneus as Achilles tendon. These muscles help in plantar flexion of the foot at ankle joint, and these muscles are innervated by tibial nerve. Popletius. This muscle arises from lateral condyle of femur and insert into shaft of tibia. This muscle help in flexion at knee joint and is innervated by tibial nerve. Tibialis posterior. This muscle arises from tibia, fibula and interosseous membrane and insert into second, third and fourth metatarsal, navicular, cuneiforms and cuboid. This muscle help in plantar flexion and inversion of the foot. These muscles are innervated by tibial nerve. Flexor digitorum longus. This muscle arises from posterior surface of tibia and insert into distal phalanx of second, third, fourth and fifth toe. This muscle help in flexion of the toes, and these muscles are innervated by tibial nerve. Flexor Hellucis longus. This muscle arises from shaft of fibula and insert into distal phalanx of great toe. This muscle help in flexion of great toe, and this muscle is innervated by tibial nerve. Thank you students for watching this video. You can subscribe the channel for latest updates, and you can like Facebook page. And for making your notes, you should visit the blog mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram and join Facebook group Nursing Notes. Thank you. Have a nice day.